I'm a dermatologist, and today I am going to show you some of the best pore strips that I've ever seen on TikTok, as well as some amazing acne transformations. We're going to learn a bit along the way as we react to these videos, so I hope you enjoy them as much as I love finding them and showing them to you guys. Let's jump into it. My freckles are so cute, I love them. Well, these are definitely not freckles. They're using the Labena Pore Strip Mask. You put the paper on after you put the product on the skin, let it dry, and then as you peel it off, you see all of these sebaceous filaments coming off. Some of these are probably blackheads, but just know if you're removing sebaceous filaments, they're gonna come back because it's a normal part of the skin. Your oil glands are supposed to be producing oil and bringing that up to the surface to moisturize the skin and act in an antibacterial fashion. We're back with another. My freckles make my nose look so cute. Again, these are not freckles. This person does have a lot of blackheads. We're on the Labena face mask again. Put the paper on. Look at all of those come out. This is just incredibly satisfying, and I actually probably want to try this on myself. I don't get a ton of acne, but of course I have sebaceous filaments, and I think I'd just like to try and see what comes out if I do this. So many women complain about their boyfriends not having a skincare routine, but having perfect skin. This one says, when I realized my boyfriend never washes his face. She puts on the Labena mask, pulls out all of those sebaceous filaments. Gotta be satisfying, but they're gonna come back. Now this guy has Favre-Rokesha syndrome. When you have severe sun damage, you're gonna get all of these comedones, all of these blackheads across the cheeks, the nose. Also, there's a lot of little hairs coming out of there. This might be trichostasis spinulosa, where you get little hairs popping out of the follicles. And this Labena mask is gonna pull all of them out. It's incredibly satisfying. These are some of the favorite patients that I see in the clinic because I can go and do extractions on them. They come out so easy and it's incredibly satisfying. I wish they showed us more of this video because I would love to see the before and after. Again, we've got a boyfriend with no skincare routine. I only wash my face with shampoo and my skin is perfect. So she's gonna do the Labena mask on him, and look at all of that stuff coming out of the pores. This is normal sebaceous filaments. If you have sebaceous filaments, this is nothing to be concerned about. I wish the video was a little longer so we could see everything come out, see the full before and after, but I just love watching these. Next up, we are doing extractions in the back of the neck. This person has a ton of scarring. It's probably a condition called acne keloidalis nuchae, where you get ingrown hairs and a lot of inflammation and scarring. So they're doing a little microneedling. Now we're doing the perfect derm peel on the skin. This is something you do have to be careful with when you're using it off of the face, because not all chemical peels are safe to do in other areas. This one probably is going to be fine for him, but this is not my preferred treatment for acne keloidalis nuchae. I've got a whole video on this on my YouTube channel. You guys can check that out if you want, on bumps on the neck like this. All right, this is the Aerolase Acne Treatment Laser. This is a 1064 diode laser, and this targets and heats the sebaceous glands. It can help to kill bacteria that cause acne, and also get some of the capillaries that are feeding the acne bumps and leading to inflammation. So multimodality. This is not my primary method of treating acne, but it is a laser designed for treating acne. So this 1064 laser that fires at 650 microseconds is a good option if you don't want to take things like Accutane, but this person has pretty severe acne. I think they'd be a great candidate for Accutane. 7-month transformation. Before and after looks great here. Let's see what they're doing. We've got acne hydrofacials. I do like that. High frequency ones, no data to support their use. Red light therapy does have some anti-inflammatory data, and they're doing acne peels for this person. Then some ProCell microchanneling. This is like microneedling. All of these are generally pretty great treatments with the exception of the high frequency one. I don't think that does much. But when you have severe acne, there are other options from dermatology like Accutane or topical treatments if you don't want to do those. This sounds like a pretty good regimen that this person went under, and it's hard to argue with the results. All right, this is the perfect derma peel. We do this peel in my office. This person has significant cystic acne, and the perfect derma peel is not my preferred treatment for acne. This is not considered an acne treatment. It can help with pigmentation. It resurfaces the skin, but it's not going to cure the acne. So hopefully they have a more comprehensive regimen for this individual, because the peel alone is not going to solve this significant acne. All right, we have a person here with acne conglobata. This is like severe cystic acne on the face, the cheeks, and they're just mashing on it. This is going to increase the risk of scarring. In my opinion, the only treatment appropriate for this kind of acne is Accutane, and in the short term, when somebody starts Accutane with this type of acne, they're probably going to need to be on steroids to limit the risk of a severe flare that leads to even more scarring. I have treated people like this in my clinic, and we can get them better, but I wouldn't recommend that you go mashing on all of this stuff. It is possible this person's on a more comprehensive regimen. I hope that is the case. If you're going to get a tattoo, you better have no regrets about that, but if you do, thankfully we have laser tattoo removal, and that is what we're talking about on the channel today, is laser tattoo removal. This is a great treatment for those who have a tattoo and no longer want it. We're going to talk about some of the nuances as we look at some of these cases today. So this person got face tattoos. Almost never is this a good idea to get face tattoos, but we're using a Cutera Q-switch laser. A Q-switch laser is going to fire very quickly into the skin to generate less heat, which means less risk of burning the individual. We see that the tattoo starts to fade immediately, but there is a bulk heating effect going on in the skin, and that's why it turns white. We're developing like little air pockets under the skin. As that inflammation goes down, the color is still going to be there. What the laser tattoo does is it breaks up the pigment particles under the skin into smaller and smaller pieces, which allows the body to digest them and take them away. Some of that's going to end up in the lymph nodes. You could biopsy those lymph nodes years down the road and probably see tattoo pigment in it. But as we break up those pigment particles under the skin, they actually become small enough that the body can get rid of them out of the skin, and the tattoo fades with time. So here we're back with a name on the face. Face tattoos are a bad idea, and generally getting somebody's name, also a bad idea. This is a pretty quick treatment, and it does hurt because it generates heat in the skin. We see that it looks a lot better, but again, this is going to, as that white color fades, there's still going to be the ink in the skin until the body can start to pull that out. It's usually going to take multiple treatments to keep breaking down those ink particles, and then we'll get a result that the person can be happy with. So here this individual has a little moon tattoo outside the eye. They're appropriately shielding the eye because lasers can be dangerous around the eye, as we know. You can hear that clicking a little bit. Quick treatment, breaking up those particles. Now, this is a pretty dark tattoo, so she's probably going to need to go through many treatments, and even in the very end, there might still be a little bit of sign that there was a tattoo there. Some people get lucky and there's no sign that there was ever a tattoo, but oftentimes there's a faint outline of what used to be. We're getting rid of a tattoo on the upper back. This person got a cross up there for whatever reason. They don't want it anymore, so we're using a laser to break up that tattoo ink under the skin. You can hear it snapping. It's hurting her because of the heat generation here. Pretty quick treatment overall, and we can see it pretty well still. This is going to take a lot of treatments because there's so much ink in the skin in a very dark tattoo. Once again, face tattoos, bad idea. Some of this is already looking a bit light, so maybe they've had sessions before, but as we trace around that, ooh, we've got like an after here. This may be after many treatments because it's actually looking pretty good. So tattoo removal like that on the face, many treatments, but I don't know how many treatments this person's had, but in the immediate after, it looks pretty darn good. Now on the hand, we are using tattoo removal lasers. Fades pretty quick. Going to go through multiple treatments. This one's probably going to end up looking pretty good. I think they're going to get nice recovery on the fingers even after multiple sessions, where there's not going to be much left of that one. Keep in mind, if you want a tattoo, it's going to be there forever. Even if you do laser tattoo removal, there's often going to be a little residual, a little sign that you had a tattoo. If you want a tattoo that will fade on its own without laser tattoo removal, there's a company called Ephemeral Tattoo. They use a different kind of ink that's similar to dissolving stitches, and this might last anywhere in the skin from about 1 to 3 years. I've had 2 of these done on myself. I've had one for just a little over 3 years, and it's starting to fade now. It just doesn't get a lot of sunlight here, so it hasn't broken down very quickly. My second ephemeral tattoo was on the back of my calf, and that one is almost 2 years old, and it's almost completely gone. But that is an option. There's ephemeral tattoo studios across the nation, and many independent tattoo artists are now picking up this kind of ink to offer additional options to their clients. If you guys want to see some videos about ephemeral tattoos, I've got some on my main YouTube channel, so you can check those out. I hope you guys have enjoyed learning a little bit about laser tattoo removal, and make sure if you are going to get a tattoo, you don't have any regrets about that. I hope you guys have a great one, and I'll see you on the next video.